As well as all the research and advocacy that we do, we also run a lot of programs and have a lot of initiatives. Some of the Penington Institute initiatives include International Overdose Awareness Day, which was first set up by Sally Finn in the Salvos in St Kilda, and we took it over in 2012 and have been running it and coordinating it for around the world since then. It's a global event held on the 31st of August every year. It aims to raise awareness about overdose and reduce the stigma around overdose. It's also an opportunity for families and friends and communities to remember people who have died of overdose and those who have been seriously affected, permanently injured. Last year there was 500 events in 19 countries around the world, which is the biggest one we've had so far, I think, and we're going to try and get it even bigger over the next few years. One of our other programs is the Community Overdose Prevention and Education Project, or the COPE program. We train workers to train clients clients and potential overdose witnesses how to prevent, recognise and respond to an opioid overdose using naloxone, the temporary opioid overdose reversal medicine. There's a few people in here who have done the COPE training. I can see a few of you actually, see you, or maybe you too. So far, we've trained about 1,200 workers at about 60 agencies across the state, from Mildura in the state's north to Lake Tyers Aboriginal Trust right down in Lake Tyers, and everywhere in between. And when some agencies put forward one worker at a time, you can see it's been quite a big achievement to do that. There's several of the COPE, or a few of the COPE agencies in here today, and you can be sure that their training has saved lives across the state. We published the Annex Bulletin. It's a speciality publication for needle and syringe program workers across the country. It's got all the latest developments in the sector. There's lots of articles about things. The latest one is stuff on tanning injections and that kind of thing, doesn't it? Which is becoming a new issue. Currently, the bulletin gets sent to 3,000 NSP workers and another 3,000 other workers that are in the sector. We're funded by the Department of Health and Human Services to support ongoing support and training for needle and syringe programs across Victoria. There's currently about 600 or so needle and syringe programs across Victoria. About 60% of them are in pharmacies. Only 19 or 20 of them are actually funded on an ongoing basis, and all the rest of them are in places like your local community health service, where you go in and the nice person behind the counter gives you a doctor's appointment and gives you a fit pack as well if you need it, some syringes. We moderate the NSP Forum. It's a free email discussion group for people working in NSP and other drug-related sectors. It's to keep up with research, and it's also used by needle and syringe program workers to find out about drug trends and other drug-related issues. There's currently about 800 people on the NSP Forum. It's very easy to sign up for it if you want to sign up when it's needed. The latest addition to the Penington Institute is the Youth Empowerment Against HIV program. It's the YA program, which came from being an independent organisation to join Penington Institute in October last year. The YA program is Australia's largest online and face-to-face engagement of young people, providing information and supporting young people to take control of their sexual health and their drug use. Through our work in NSPs, and especially through things like Overdose Awareness Day and the COPE program, we've tried to get a focus on fentanyl and the risks around fentanyl. Now, it's fair to say that we're absolutely nowhere near the state of things in North America and Canada at the moment when it comes to fentanyl, but we don't want to get that way either, so we want to do a lot of this kind of work at the start. The Australian Bureau of Statistics compiles deaths from fentanyl, tramadol and petadine as one single category. In 2001 to 2005, there was 102 deaths in this category in Australia. By 2011 to 2015, there was 796 deaths in this category. That's 796 people, because we've got to remember we're talking about people all the time when we talk about these numbers. That's an almost 800% increase. When we release Australia's annual overdose report later on this year, we'll have the latest figures, and my guess is they'll probably go up from there. Before Christmas, as part of the Victorian Government's naloxone subsidy initiative, which aims to reduce overdose deaths in Victoria by getting naloxone into people's hands, the Department of Health and Human Services asked us to do a series of training seminars across the state, which we did. We did 18 of them all over the place.